Statins are a class of drugs that lower cholesterol levels by inhibiting the enzyme HMG-CoA reductase, which is responsible for the synthesis of cholesterol in the liver. By reducing the production of cholesterol, statins also increase the number of LDL receptors on the surface of liver cells, which help remove LDL cholesterol from the blood. LDL cholesterol is considered bad because it can accumulate in the walls of arteries and cause atherosclerosis, a condition that increases the risk of heart attack and stroke. Statins are mainly used to prevent cardiovascular disease in people who have high cholesterol levels or other risk factors such as diabetes, hypertension, or smoking. Statins have been shown to reduce the incidence of heart attacks, strokes, and deaths from cardiovascular causes in these populations. Statins are generally well tolerated, but some people may experience side effects such as muscle pain, liver damage, or increased blood sugar levels. There are some alternatives to statins for people who cannot take them or need additional cholesterol-lowering treatment. One of them is ezetimibe, which blocks the absorption of cholesterol in the intestine and lowers LDL cholesterol by about 15 to 20%. Ezetimibe can be used alone or in combination with a statin. Another option is PCSK9 inhibitors, which are injectable drugs that block a protein that interferes with the function of LDL receptors. PCSK9 inhibitors can lower LDL cholesterol by 50 to 60% and reduce the risk of cardiovascular events when used with a statin. However, PCSK9 inhibitors are expensive and may cause allergic reactions or infections. There is some controversy about the role of cholesterol and statins in older people, as some studies have suggested that high cholesterol levels may be protective or have no effect on mortality in this age group. However, these studies have been criticized for their methodological flaws and lack of consistency. A recent review of randomized trials of statin therapy in older people found that statins reduced the risk of major vascular events and coronary deaths, regardless of the baseline cholesterol level or age. The review also found that statins did not increase the risk of cancer, dementia, or adverse effects in older people. Therefore, statins are still considered an effective and safe treatment for lowering cholesterol and preventing cardiovascular disease in most people, especially those who have high risk factors or existing cardiovascular disease. However, statin therapy should be individualized and tailored to each person's needs and preferences, taking into account their medical history, lifestyle, and potential benefits and harms. Sure, I can try to explain that. PCSK9 inhibitors are a type of medication that lowers the level of LDL cholesterol, which is considered bad because it can cause plaque buildup in the arteries and increase the risk of heart disease and stroke. PCSK9 inhibitors work by blocking a protein called PCSK9, which normally binds to and destroys the LDL receptors on the liver cells. LDL receptors are responsible for removing LDL cholesterol from the blood and taking it into the liver for breakdown. By preventing PCSK9 from destroying the LDL receptors, PCSK9 inhibitors increase the number of LDL receptors on the liver cells and enhance the clearance of LDL cholesterol from the blood. This results in lower LDL cholesterol levels and lower cardiovascular risk. There are currently 2 approved PCSK9 inhibitors, alirocumab and evolocumab, which are given as injections under the skin every 2 or 4 weeks. A third PCSK9 inhibitor, inclisiran, is a small interfering RNA that blocks the production of PCSK9 in the liver cells and is given as an injection every 6 months. PCSK9 inhibitors are usually prescribed for people who have very high cholesterol levels or who have had a previous cardiovascular event and are not able to lower their cholesterol enough with other medications, such as statins and ezetimibe. PCSK9 inhibitors have been shown to be effective and safe in reducing LDL cholesterol levels and cardiovascular events in clinical trials. However, they are also very expensive and may not be covered by all insurance plans. There is enough studies about PCSK9 inhibitors that you can learn from. Statins and PCSK9 inhibitors are 2 types of medications that can lower cholesterol levels and reduce the risk of cardiovascular events, such as heart attacks and strokes. However, they have some differences in how they work, who they are prescribed for, and what side effects they may cause. Statins work by blocking an enzyme in the liver that produces cholesterol, while PCSK9 inhibitors work by blocking a protein that destroys the receptors that remove cholesterol from the blood. Statins are usually the first-line treatment for high cholesterol, as they are effective, safe, and affordable for most people. PCSK9 inhibitors are usually reserved for people who have very high cholesterol levels or who have had a previous cardiovascular event and are not able to lower their cholesterol enough with statins or other drugs. PCSK9 inhibitors are more effective than statins at lowering cholesterol levels, but they are also much more expensive and require regular injections. Both statins and PCSK9 inhibitors have been shown to reduce the incidence of cardiovascular events in clinical trials, but the long-term safety data for PCSK9 inhibitors is still limited. Statins are generally well tolerated, but some people may experience side effects such as muscle pain, liver damage, or increased blood sugar levels. PCSK9 inhibitors may cause allergic reactions or infections, but they have fewer effects on the muscles, liver, or blood sugar than statins. Therefore, statins and PCSK9 inhibitors are both beneficial for lowering cholesterol and preventing cardiovascular disease, but they have different advantages and disadvantages. The choice of medication depends on the individual's medical history, lifestyle, preferences, and insurance coverage. You can learn more about the comparison of statins and PCSK9 inhibitors from the approved clinical research studies. I hope this helps you.